Rural Health Policy to create this guide. The guide is really relevant for anyone that is doing subcontract management, be it through a grant process or elsewise. But the examples in it are specific to the FLEX program, and it was truly developed with the FLEX program grantees in mind. The guide looks at laying out how to develop and define clear contract expectations within the scope of work, how to outline an expected timeline for deliverables, and how to plan for consequences in the event that deliverables aren't met, or the scope of the work, or there's slight shifts in the work that happen, and how do you adjust for those kind of midstream, and then how to establish reporting requirements that demonstrate the impact of services. So that the contract management guide really talks about the full life cycle of that contract management from initiation to closeout. And it was developed by Rebecca Bradley Dowdy. Rebecca joined Affiliated Enterprise Solutions team in 2006, and she serves as the Vice President for Healthcare Consulting Services. She has extensive experience with the FLEX program in rural healthcare, and she brings 14 years of healthcare and hospital association management experience to her role. She most recently served as the Vice President of Policy and Member Engagement at the Louisiana Hospital Association, and as the Vice President of Business Development at ShareCore, the shared services company that's owned by the Louisiana Hospital Association and the Metropolitan Hospital Council of New Orleans. Over the past 12 years, Rebecca has directed the development of healthcare policy and reimbursement initiatives on behalf of hospitals in Louisiana, and she's overseen various policy activities within state and national policymakers. She is a recognized healthcare leader in directing cutting-edge business solutions and multifaceted project teams, and she really has an in-depth knowledge of the workings of the FLEX program, and is seen as certainly a colleague of both the Technical Assistance and Services Center as well as the Federal Office of Rural Health Policy. It was great to have her insights and in developing content for this guide. So with that, I'm going to turn things over to Rebecca to lead us through kind of the highlights of the guide and what can be expected from using the guide.
Well, good morning or good afternoon, depending on what area of the United States you're in right now. I'm currently in Texas myself, so it is afternoon here for me. Tracy, thank you for that introduction, and Nicole, thank you very much for coordinating this webinar. I appreciate all of the people that have dialed in. I'm recognizing quite a few names on the participants list, but there's also a few others that I have not had the honor of meeting yet. So I will just very high level give a little bit more depth into my background and where I'm coming from as far as this specific program is concerned. During my 12 years with the Louisiana Hospital Association, I did have the extreme honor and privilege to work very closely with our State Office of Rural Health, who houses in the state of Louisiana. They house the FLEX program. And I was also a subcontractor to that program for multiple years. And we had a great level of support from various statewide stakeholders for the program, and a lot of great friendships were formed and things accomplished in order to support our rural hospitals and rural healthcare networks. So really a great program, and I had a lot of personal success just participating in it. So I come to you today from that angle specifically, and then also I am a certified project management professional. I do have my PMP license, so that's where we're looking at this from, I guess, the project life cycle focus. So with that, I will try my best to navigate the slides. Do I have control of the slide deck, Tracy?
You do. You should see in the lower left-hand corner right and left arrows.
They work this time. Thank you very much. So our overview and our agenda is we're just going to talk a little bit about the FLEX program background and then go specifically into the project life cycle. And as y'all are all aware, the National Rural Resource Center, Technical Assistance and Services Center has utilized FLEX funds to develop the contract management guide that is the subject of today's call. And the guide and this presentation are designed to target common opportunities within the FLEX grant to just improve the scope of work requirements for subcontracted vendors and consultants. And it was the intent to really assist state programs in building greater accountability into their subcontractors to deliver more meaningful information which ideally should further improve program deliverables, reporting, and outcomes. So state's office rural health directors and flex program coordinators are encouraged to use this guide as strategies to help ensure that their grants are successfully developed, coordinated, implemented within their state. And looking at the guide specifically, which I think was an attachment to today's email, the guide is aimed at helping State Office of Rural Health Directors and Flex Program Coordinators with really developing and defining clear contract expectations within their scope of work, outlining expected timelines for deliverables and planning for consequences in the event that those deliverables are not met, which I'm sure never happens in any of our states, but in that odd time when it does, hopefully we'll have some tools to utilize in those times. And then also establishing reporting requirements that demonstrate the impact of the services. And today we are going to step through the history of the FLEX program and, like I said, some of the phases of project life cycle as it relates to administration of that FLEX program. So, getting started, we're going to go back to where it all began, and that is the establishment of the Medicare Rural Hospital Flexibility Program, or as we all refer to it as the FLEX program. And it was established by the Balanced Budget Act back in 1997. So a long history of really great projects have been administered through this very valuable program. And as you're all aware, any state with rural hospitals can establish their Rural Hospital Flexibility Program and apply for federal funds that provide for the creation of rural health networks, promotes regionalization of rural health services, and improves access to hospitals and other services for rural residents. The FLEX program also established our critical access hospitals, and in those states where we still see a few conversions, it is there to help any hospital that is eligible for conversion to critical access status. Back in 1999, the Technical Assistance and Services Center, TASC, was created by the Federal Office of Rural Health Policy, and they're here to provide us with technical assistance and resources, and also to give us some networks, opportunities, and share, I guess, nationwide best practices, peer learning, and tools, which basically, I guess, is what brings us together here today. So if you aren't leveraging the National Rural Health Resource Center, and especially the talent at TASC, I strongly encourage you to do that and reach out to Tracy and Nicole and Sally over there at the center, because a lot of very valuable resources, some of which we will hit on during this call, but there's all available on their website. So just the overall goal of the FLEX program is to enable states through federal funding to meet the FLEX program goals of improving quality of care and financial operational outcomes for their critical access hospitals. So that's a little bit of the history of why we're all sitting here today and why we have the funds that we have. Looking at how those FLEX programs are administered in each state, I guess, how are they typically administered? I know typical is going to be found in the State Office of Rural Health. However, this is just not always the case. Some FLEX grants are administered by the state hospital associations, and some are even housed within university programs. And I think that these variations do tend to lend to some of the challenges with subcontracting, just based on the various governance, regulatory, policy implications that FLEX coordinators have to comply with. And as they carry out the FLEX program's primary focuses of providing states with that added resources to assess things like community health and emergency medical service needs of critical access hospitals, fund projects aimed at improving community and population health, improving critical diagnosis identification and management time, improving EMS capacity and performance. I think we all recognize that the administration of the FLEX grant objectives definitely is challenging because it's so encompassing of rural health care, but it also really lends itself quite naturally to strategic state partnerships and subcontracting for certain aspects of the grant to entities that are considered subject matter experts, or SMEs, if you will, in the grant's priority areas of focus. I think it's those relationships and those strategic partnerships that you see proliferated throughout the state, and why this program is really so successful at providing those services to the rural community, just because of the abundance of really successful state partnerships and programs. So getting more into the meat and potatoes of today's call, we're going to look at the project life cycle. Project management methodology really helps us to define a project scope, timeline, resource allocations, and deliverables for any given project, and the FLEX program is very much falls under this. To deliver successful projects from start to finish, we're going to walk through the project life cycle step by step today, and how it can assist state FLEX programs with using similar project management processes for delivering on those key objectives that we discussed for the FLEX program. And the goal of using these methodologies is to complete the tasks required for the project more effectively and with strategies in place to handle those issues when they may arise. So, getting into the project life cycle. We are going to start with initiation phase, which is your very first phase for any project life cycle. And it's when the project manager is really conceptualizing the project. So in your state, that's probably going to be your state office of rural health, or whoever your FLEX coordinator and the program team that they have assembled can look at what they want to do and how they want to utilize those funds to really achieve success in their state, given their specific needs. So this phase is going to outline the basic processes that must be performed in order to start the project, and it should begin to specify what the project output is really there to accomplish. So prior to grant award is typically when this is actually going to take place, and it's recommended that the FLEX program coordinator and State Office of Rural Health Director really work together at this point to identify the portions of the grant where the state FLEX program does not deem that they have access to the appropriate level of expertise within their organization, and start identifying those program activities that they're going to need to subcontract out. One of the ways that you can really start nailing this down is using one of the tools through the National Rural Health Resource Center, and it's the core competencies for state FLEX program excellence self-assessment tool. If you haven't used that, I strongly encourage everyone that they should, and a great method to identify the strengths of a FLEX program management team. So there's also, I think, a hyperlink in this slide deck as well as in the report to that report that will take you directly to that assessment tool. And after review of those program activities, the FLEX team can then really start to assemble various categories of work that require common skill sets to complete. And this begins the process to define those deliverables for any given subcontract that you're going to have to bring in subject matter expertise for. And as that work performed under the grant funding reaches across the healthcare sector, it really is necessary to develop those detailed subcontractor selection criteria in order to facilitate the method for selecting the most appropriate subject matter expert for any given task. So that brings us to our next slide that really kind of outlines subcontractor selection criteria and how we can go about really digging into where we have talent in the state or nationwide and bringing in that expertise that's going to really help drive success for your program. So we're at the phase where all of our deliverables, I guess, have been outlined at this point. And the next step is really to determine what those skill sets that are needed in order to complete the subcontracted program activities. Here, and this is a great opportunity to send out a request for proposal. I don't know if your states utilize that, but it is recommended for a state to use an RFP process. where you send that out to state partners to identify what their field expertise is, and hopefully it's going to be with known and demonstrated knowledge base in the areas of required expertise, where you're going to start looking for how they're going to respond to those requests for proposals, and hopefully it's going to be in their words sent back to you and not you sending out what your need is to them, so that way you know that they are actually thoughtfully developing the program and what they're going to deliver to you. So if you don't have local partners available to you, your project team can also send out that RFP nationally to recognize SMEs, and if it's at all possible, it's always best to utilize the skills of subcontractors that are recognized as skilled experts and have demonstrated success with working on similar projects and similar audiences. Here's where networking and relationship development are key components to identifying individuals or entities to partner with and to bring known talent to your project. So when you're selecting a new subcontractor for grant activities, this list is a great list of attributes for your decision-making process. You can find potential state partners for subcontracting from your state hospital association, your state rural health association, your quality improvement organization, area health education centers, your AHEC, your state primary care associations, state ambulance alliances, etc. So you can see that there is an abundance of potential state partners for you to look into. In addition to your state partners, it's recommended that you utilize some of the national resources that are available. And some of these suggestions would include tapping into, here again, the National Rural Health Resource Center, Technical Assistance and Services Center, TASC. The National Rural Health Association is a great place. HRSA's, Federal Office of Rural Health Policy, another great resource. The Rural Quality Improvement Technical Assistance, RQITA, the National Organization for State Offices of Rural Health, NOSTOR, Joint Committee on Rural Emergency Care. Those are just some of the abundance of opportunities that are out there for seeking national recommendations for great experienced consultants that are trusted and have delivered on similar projects that you would be executing in your state. So those are all listed in the attached report for you to consider. I do want to pause a moment here and let's talk a little bit about historical and legacy contracts, because I'm sure that some of you are probably new to your position, and just based on the longevity of the FLEX program, there are going to be situations that arise in which you have to review and modify programs and contracts that you have inherited and are really considered, like I said, legacy contracts. They've been around for years, but maybe some of those contracts, just the subcontractor isn't performing as well as one would expect or hope. So as a FLEX coordinator, that really puts you in a tough place of deciding how to modify those contracts with existing subcontractors, or even coming to the decision to terminate a legacy contract and find a new subcontractor, because you have, these are typically going to be with established state partners, and some trusted relationships and sensitivity, I guess, is the best word to use, would need to be applied in order to really navigate that process. So this is one great reason why demonstrating, I guess, your value derived from grant-invested funds really has added value. And I would recommend that in addition to demonstrating the success of a grant, it's going to enable you as a FLEX program coordinator or your State Office of Rural Health to make data-driven decisions on the continuation of funding specific project activities through historical contracts. So FLEX coordinators, you're going to find yourself able to utilize this information gathered from things like the Critical Access Hospital Satisfaction Assessment, really to inform your decision regarding the quality of work performed by your subcontractors. And whether the subcontractor is an established state partner or a newly identified resource, it's really imperative that the planning phase for Flex grant activities really include that look at a defined statement, SOW, your scope of work, your timelines, deliverables, and payments that are tied to timely completion of milestones and deliverables. And that's going to give you the data that you need to historically look back and look at those legacy contracts and make an educated decision that is hopefully going to not hinder your state relationship with your partner, but will enable you to come to the table and either renegotiate those legacy contracts or come up with a better solution than the subcontractor that you currently are working with. So just really wanted to take a side note there and talk about that, because I think probably a lot of you may be finding yourself in a similar position. I know it's not an easy one to be in, but hopefully that will help you with dealing with some of those programs that you have to navigate through. So that really wraps up your initiation phase, and now we're going to move into our planning phase. And I guess for the sake of the webinar, it's really hard to ask questions. If anyone does have a question right now, I'll gladly take it. I think it's *2 to unmute. If you have any things that you're dealing with as far as legacy contracts or any questions up until now, we'll take those. So I'll pause for just a few moments. Okay, hearing no questions, we will just continue trucking through with the planning phase here. Your planning phase represents your second phase in the project life cycle. And the purpose of this phase is really to start defining your SOWs, your deliverables, and payment process for any services that are going to be rendered through a subcontract. This is a great time to also address communication and the deliverable completion acceptance process that you're going to be utilizing with your subcontractors. Communication is going to be key here to really establishing those relationships and making sure that everything is done on time according to your scope of work, and that your project moves forward smoothly. So this planning process is going to help guide the project team through the execution and closure phases of the project, and the time and effort really spent during this phase will greatly assist you in managing time, managing costs, quality, risk, and any future issues. So definitely taking the time in the planning phase is well worth it as you start moving through the other phases of the project life cycle. So one of the biggest things here is your scope of work, and developing an effective SOW or scope of services, whatever you call it in your state, with clearly defined deliverables that are tied to a definitive timeline and delivery dates is imperative to executing a successful relationship with a subcontractor for the completion of any and all grant activities. So your subcontract SOW should establish your expectation for deliverables, and those need to include things like defining the outputs. What are your contract deliverables versus the outcomes of the project or intervention provided by the contractor? What it needs to include the establishing of benchmarks to set your baseline measurements. It needs to include things like a method for tracking key performance indicators, for determining outcomes and the impact of services. So these are all things that you need to be thinking about as you start developing those scopes of work. So in your state, how and when does your state really complete the planning phase? That's going to be really critical, especially given the funding challenges that we typically run into with the Flex grant. And the closer to the beginning of your fiscal year you can really start executing those subcontracts is going to be just so much more helpful. So, it's really best to begin your subcontracting selection process activities really in advance of your fiscal year for your grant cycle, if your state guidance will allow that. I know several states really have a lot that they struggle with there. So as close to the start of your fiscal year as is possible, I totally recommend that. And really by drafting your subcontracts and executing your agreements in advance of a fiscal year start for your grant cycle, your project activities will be able to really be ready to begin in that first month and not be pushed off till several months into your grant life cycle, your grant timeline or life cycle. So in the event that your state guidance really does not allow you for an early start on any of your subcontracting, really consider pre-drafting the subcontract and be ready to execute at the start of the fiscal year of your grant cycle. Because timelines are just critical towards working towards the completion of your Flex program activities and getting everything done by the end of the program year and reducing your unobligated grant balances. I know that was something that we've severely struggled with in Louisiana. We worked our way around it. We definitely trusted the process and understood that it was a process, but it's certainly something to keep in mind. And I want to make sure I'm on the right slide. Yes. So moving on in our planning phase, next we're going to talk about really the deliverables and project payments. So defining your deliverables. All subcontracts really include contractual clauses for building accountability and really holding your subcontractors accountable for ensuring all contracted deliverables are met. So the time frame for the agreement should include the contract execution date. It needs to include milestone dates and deliverable or completion dates. So developing milestones, you can actually achieve this by breaking longer projects down into events or processes that show timely progress of the work to be completed. And failure to build this accountability into a subcontractor agreement it really results in ambiguous deliverables that really don't address the intent of the original agreed upon work, and it really puts your overall grant awards in jeopardy. So we really want to tie up what your deliverables are and what you're specifically expecting your subcontractor to deliver and when. So it is imperative here that we really clearly understand what the Flex Coordinator is contracting for and for the services that are expected to be provided by your subcontractor. So during the assessment that we did for this report of Flex Coordinators, it was really recommended that the subcontractor should deliver a response to that request for proposal, communicating the expected deliverables in their own words for consumption, editing, and ultimate approval by you, the Flex Coordinator. So that was a recommended best practice that we came across from seasoned Flex Coordinators that we talked to in the creation of this report. The next step is your project payments. All payments should be tied to specific deliverables here. So by structuring payments in this fashion, you as a Flex Coordinator, you're able to maintain a greater ability to hold your subcontractors accountable to the delivery of quality and timely work. If the clearly defined deliverables are just not met in accordance with the timelines defined in the contract, then really delaying, modifying, and withholding of payments are all options to incentivize your underperforming subcontractors. Options that can be exercised for withholding payments if deliverables are not met in a timely fashion, they could include things such as partial payment for missed and delayed deliverable dates, non-payment for work not performed per your contract specifications, termination of the agreement for failure to comply with the terms of the contract, and terms should be clearly outlined in the executed contract. So really highly recommend that as far as defining your payments. Our next slide really talks about data sharing And this is huge for the Flex grant. One of the key objectives of the Flex grant is to improve the delivery of health care in rural areas through established benchmarks and examining progress towards improving your key performance indicators. So as a Flex coordinator, you really should be considering including statements within your subcontractor's SOW that will utilize the available data that's out there through programs such as the Flex Monitoring Team Data Report and the Medicare Beneficiary Quality Improvement Project, or MBQIP data, as it's appropriate to support assessments and projects. In addition to that, there's several other sources of data residing out there in your state within the operation of various potential state partners. These include, but are certainly not limited to, your state hospital association, your state rural health associations, your QIOs, state health information exchanges in the states that have that. So most state statutes or regulations are going to require the inclusion of additional state language for data disclosure statements and data release forms in any state-issued subcontract. So it's something, if you are utilizing some of this data, to be aware of. In the instance of this occurrence, it's really advisable to seek guidance from your state office of General Counsel or the State Department of Health or the Division of Administration with legal counsel to inform of the correct process, really, to ensure compliance with state statutes and regulations and provide contract language. But to move forward with sharing of data with subcontractors, data use agreements and non-disclosure agreements, we have an example of both in the actual written report. These really should be used to address how your subcontractor will access confidential information or will support any data sharing. And executing a data use agreement or your non-disclosure agreement, whichever is appropriate for the data that you are sharing, is really an important step in the subcontracting process to ensure that all sensitive hospital information will be kept confidential. And it also gives you coverage in that event. Hopefully it doesn't ever happen, but in the event of a breach of the data, your data use agreement and your non-disclosure agreement are going to provide you, the Flex team, with a means to pursue your corrective action or remediation for damages in the cause of negligence on the part of a subcontractor. And really, verbal agreements are just not adequate substitutes for any formally executed data use agreement or non-disclosure agreement. So strongly recommend taking a look at the attachments here and utilizing those as maybe examples on how you could put some protection in place for the data that you are sharing with your subcontractors. So here again with data sharing, there's additional reports out there. An abundance of data is available for you through your FMT. A recent article that was sent out from the FMT features the availability of your Flex Monitoring Team Data Summary Report, which is, there's a hyperlink to that listed here for your Critical Access Hospital Financial Indicators Report, and it's a summary of indicator medians by state. This report represents state and national median values for 22 financial indicators, included in the CAFIR, I think is how it's commonly referred to, which is your Critical Access Hospital Financial Indicators Report. Hospital-specific CAFIRs that were distributed annually to each call administrator are now available via real-time access to the Critical Access Hospital Measurement and Performance Assessment System. And each Critical Access Hospital administrator has received a personal login code, and that, if it's been lost, can be retrieved by contacting the FMT office for assistance. The state median represents the report utilizing the 2013 Medicare cost report data, and hospital and state data reports are also sent out to Flex program coordinators quarterly from your Federal Office of Rural Health. These are all excellent data sources.
Rebecca? Sorry to interrupt you, but the audio is kind of fading out a little bit.
Oh, I apologize.
That's better.
Let me modify that. Sorry, I got too far away from my speakerphone. Thank you for that correction. So those are all excellent data sources for tracking your outcomes of your Flex Grant activities, and we strongly recommend utilizing those in your program. So now we'll move on to the execution phase, and your project execution phase is typically going to be your longest phase, and it's going to involve implementing the plans that were created during the project planning phase. So the Flex Coordinator is now going to be responsible for really ensuring that the activities of the grant are kept on time, on budget, and within the defined SOW. So this is going to fall into two buckets. One is your technical monitoring and your financial monitoring. Under technical monitoring, subcontractors really should report progress on all established key performance indicators and the timely completion of contract deliverables to the program Flex Coordinator on really regular intervals throughout the life of the contract. And conducting quarterly status meetings with subcontractors or monthly calls are useful and effective methods to track that timely progression of work towards completion of the deliverables. So this communication is really best if it's in writing and inclusive of an update on the progress of all work included in the SOW. But having those meetings, either just even if it's a monthly phone call that this is on your calendar, just having that communication set up is going to benefit you so much in just making sure that your project is tracking and progressing in the manner that you hoped it would. So here again, the center has previously produced a really helpful toolkit that provides tips on working with Flex program subcontractors, stakeholders, partners, and addressing methods to demonstrate outcomes. And there's a link to it here, the Engaging Subcontractors and Partners in Demonstrating Outcomes toolkit is going to include templates for budget tracking, program activity sheets, as well as some example contracts for services with a subcontractor. So extremely useful tool that I highly recommend you click on and go out and see what's out there that you can leverage in your state. So the other piece of it is your financial monitoring. And here, in order to manage the revenue cycle of a subcontract, the submission of invoices for payment should really only take place upon the demonstration of timely completed deliverables. So for project activities that span a greater time period, the establishment of milestones to track completion and trigger payment for work completed is really advised here, with the larger payment being tied to the completion of the entire scope of work. So really hold off a sizable chunk of your payment till the end there in order to incentivize properly. And in the event that a milestone is missed or your subcontractor fails to meet the contract deliverables, payment should really be withheld or delayed until that subcontractor satisfactorily demonstrates completion in accordance with your contracted SOW. Here again, another extremely useful tool through the center, the Flex Program Subcontract Tracking Spreadsheet. Valuable toolkit that includes tools, tips, and communication strategies with an emphasis on financial management or the revenue cycle of the contract. And it's helpful information to really assist you in guiding the monitoring of the financial performance of your grant. So hyperlink included here and included in the actual guide. Strongly recommend you going out and looking at those tools as well. Next up is the closure phase, which is our final phase of your project life cycle. And this project closure phase is going to include the submittal of closeout notices, your submission of any final deliverables, and your final invoices. This phase will be predetermined pretty much by the end of your subcontract timeline or the end of the grant fiscal year, and the program coordinator is going to be responsible here for ensuring that all subcontracted work is completed within the time frame, and really to alert any subcontractors as to the final date invoices will be accepted for processing. So when you get that communication going out to them. So what happens when a contract deliverable has not been met for any of the following reasons? Deliverable timeline not met, scope of work not completed, data reports not delivered, failure to provide benchmarking tools or demonstrate outcomes of the project. What do we do from the state office, from the Flex program coordinator side in order to remediate any of those things? Well, the state Flex program and your state office of rural health, you do have the right to withhold payment for services if a subcontractor fails to deliver on any of these referenced items. So in having tied your payments to milestone completion and defined deliverables, your Flex program is really in a position to maintain program integrity, and you're better informed on the process to only make payments upon the successful completion of tasks. So the subcontractor really should only be paid upon the completion of all deliverables. But hopefully at the end of the day, at the conclusion of your program life cycle year, the work is performed in order to support rural health through the Flex program and the State Office of Rural Health. And it should really be a great time to celebrate with your state partners, because you have invested the time in the front end of the project life cycle to put a detailed SOW, a timeline, and defined deliverables in place. And then you've carefully monitored the progress of the project, and the closing of the project will be a time to celebrate the documented success of the grant and its contribution to improving rural health care in your state and actually nationally. So with that, I'm going to wrap up in my conclusion. And basically this guide has been designed to target common opportunities within the Flex program or your State Office of Rural Health to improve upon the development of your scope of work requirements for any subcontractors. Its focus was to assist you in building a higher level of accountability with your contracts or subcontractors to deliver upon more meaningful information to further improve program deliverables, reporting, and any outcomes. And Flex program coordinators should really focus their time and efforts in the beginning stages of the grant life cycle on developing and defining clear contract expectations within the scope of work, outlining your expected deliverables for the work plan and timeline, and really by planning in advance for consequences in the event that all deliverables are not met. Your state grantee is in an excellent position to actively monitor and hold subcontractors accountable for delivering quality, measurable, outcome-driven work on time. So in establishing reporting requirements that provide data and demonstrated impact of services, really the overall impact of the execution of the Flex program will be improved. And an important part of the Flex program is really telling the stories of how the program has and continues to make a positive impact on the delivery of safety net healthcare services in rural America. And it's just imperative that the rural community demonstrate the impact of this federal investment of resources through activities such as the Flex program, and through tracking and demonstrating success through benchmarks and utilization of available data. The overall Flex program is really strengthened, and when it comes time to award next year's funding cycle, it's a no-brainer basically to keep this program going just because of all of the great things that it has contributed to rural America. So with that, I will wrap up. And here is my contact information. If you have any questions later that you think of, please feel free to reach out to me. or I will also open up for questions now. I think we have about 15 minutes left in this call for questions. So open that up to you now.
Thanks, Rebecca, so much for sharing the highlights of the guide and you know, the importance of subcontract management. I don't know of a flex program out there that isn't subcontracting at least a small portion of their work out. So this is applicable to all of us. It looks like there's a question in the chat box from Mary Jane Clark in Illinois, and she was wondering, with subcontractors that funds are obligated for, but the funds may not be expended, is that carryover funds, or is it obligated until the scope of work is met? And maybe ORHP, if there's some folks on the line, could also kind of chime in on from their perspective on that. That would be helpful. A reminder, it's *2 to unmute lines. Do you have any thoughts on that, Rebecca, or anyone from FORHP?
You know, my thoughts are it would be determined by how you have structured that in the actual subcontract. So in the event that you could carry those funds forward, I think that would be a program operational question that would need to be responded to. But the way that you're actually going to pay out those funds to the contractor or the subcontractor, and when those funds are going to be spent upon the completion of those deliverables, is really something that should be addressed in that actual subcontract. Is anyone on the line that could answer from the, I guess, regulatory or policy perspective on carryover funds through the grant? Well, we will get you a very clear answer to that. Any other questions? I see some more people are typing. Oh, thank you.
Hey, Rebecca, I had a question about, this is Caleb from Task. I had a question about the, a little while ago, previous slides, you referenced an option for withholding payment or delaying payment due to deliverables not being met. And it kind of goes into Mary Jane Clark's question of, if I have those funds already obligated, I don't know how much option I have to not spend them, or maybe I have pressure to make sure that it's spent, either institutional pressure or otherwise. Do you have suggestions on that, or can you speak to it a little bit?
Absolutely. I think the primary focus here is we certainly don't want to be paying a subcontractor that is not delivering. So if you have obligated those funds through a subcontract, if that subcontractor doesn't deliver on the requirements, then we certainly do not want to pay them for services that were not rendered. That's, I guess, one piece of that response. And then the other piece is, in the event that you do wind up with some residual funds, certainly carry forward is an option if that's available to you. Or I know in the state of Louisiana, we would get together towards the end of the year. We knew when the grant was going to end, and we would just reassess what funds were still in the bucket and what we had on our wish list of things that we were wanting to do but hadn't gotten to actually achieve. And sometimes we would bring up that list and fund some of those projects through the approval of, clearly the Federal Office of Rural Health. But that was kind of the way that we went through the process of making sure that we allocated every dollar that was available to us to a project that was going to benefit our rural healthcare network.
Thank you.
Yeah, that's a good suggestion. It's always, I guess, a good idea to kind of have a little project in your back pocket just in case.
Yep.
And documentation, I think, really helps too, because if I go to whomever, a funder or my boss, and say, well, yeah, I didn't spend this $10,000, but it's because the job wasn't done, they're going to be more happy with that than when I say I spent the money and I didn't get the job done.
Mm-hmm. Absolutely, yes. Good point.
Other questions for Rebecca at *2 to unmute your line? Okay, well with that, Rebecca's contact information is up on the screen. We can follow up on if ORHP has a response on how they kind of view those funds, if they're unobligated or if they are obligated, and what that really means for a carryover, particularly when we're crossing project years. And if you have any questions about the contract management guide or Flex program support, whatever it may be, do feel free to reach out to TASC at any time. We are your technical assistance center to support you in your Flex program work. And please take the time to review the guide and the content in it, and definitely share it with the staff in your office as well. Before you leave today, we'd ask that you answer a couple quick questions here on the screen about your satisfaction with the webinar and it's increasing your level of awareness about subcontract management and just overall satisfaction with the webinar. And there's a box there at the bottom of the screen too, after you answer those questions, about